Hello students, welcome back to my channel. So we are studying immunology from the first aid and today's topic is complement. So the complement is actually the system of hepatically synthesized plasma protein that play a role in innate immunity as well as inflammation. So there are two complement activation pathway. One is the classical pathway and the next one is the alternative pathway. The classical pathway is activated when there is decrease in the classical pathway is being activated by the IgG and IgM mediated, and they are decreased in SLE, in immunocomplex diseases as well, and the C1, C2, C4 are the component of the classical pathway. CH50 is a test that is used to screen for the activation of the classical complement, and the alternative pathway is C3b, C5b to 9, and C3a, C4a, C5a. And these all C3a, C4a, they are responsible for the neutrophil chemotaxis, and C3b binds bacteria and is responsible for opsonization. C5b to 9 is actually get a nice big mark from 5 to 9 p.m. So it is responsible for the activation against the Neisseria. Then we have the C3a, C4a, C5a are responsible for the anaphylaxis. So they're responsible for the neutrophil chemotaxis. The test that is for the alternative complement pathway is the AH50 test that is decreased in Neisseria. The complement alternative pathway defects affected B and affected D is involved. Then there are inhibitors, decay accelerating factors, which is also known as CD58 and CI inhibitors. They help prevent the complement activation on cells, for example, RBCs. And then we have the complement deficiencies. So there are two types of deficiency: the early complement and the terminal complement. The early complement is actually the C1 to C4. It can cause the immune complex problem and the infections, the recurrent pyogenic infections such as the sinus and the respiratory infection, and it also increases the SLE risk. Where the terminal complement is C5 to C9, that is the MAC complex. If there is a problem in the MAC this complex, then there is increased susceptibility to recurrent Neisseria infections. So if there is a problem in C3 or this complex or complement pathway, for example sepsis, then CH50 and AH50 both get decreases. So together is for the terminal. The mnemonic you need to remember is a CAT. C is for the classical pathway, that is CH50 test, and then A is for the alternative complement pathway, and A is for AH50 test, and T is for the terminal or together pathway. That means both of them will be decreased. Then if we talk about the complement regulatory protein deficiencies, so there are two type of diseases. That is, one is C1 inhibitor deficiency, and the second one is paroxysmal nocturnal hemoglobinuria. So if we talk about the C1 inhibitor deficiency, the cause is usually the uncontrolled kallikrein, that is bradykinin. So it is avoiding ACE inhibitors because it can cause increase in bradykinin. Disease is hereditary angioedema, and it can cause the swelling of the face and decrease the C4 level. The treatment is usually the islanitide and acetaminophen that blocks the bradykinin receptors and inhibit the kallikrein. Paroxysmal nocturnal hemoglobinuria consists of four features: 3H and 1T, hemolytic anemia, hypocellular marrow, and hemoglobinuria and thrombosis. So hemolytic anemia and hypocellular marrow is pancytopenia, hemoglobinuria is dark urea, thrombosis is actually the Budd-Chiari and the Budd-Chiari and portal and the cerebral veins that are being affected by the thrombosis, and then they are being treated by C3 inhibitors as well as silozumab. Then there is one condition, that is the PIGA mutation. There is no GP1 and no CD55 159, so the complement are destroyed by the RBCs and result in dark urination and thrombosis. So CD59 is the main one, whereas CD55 is the minor one. CD59 blocks the MAC, and when it loses, it causes the intravenous hemolysis, and it reduces the C3b, and when this loss, it increases the C3b and causes the external hemolysis. So this was all about today's video. We are going to talk more about immunology in the next video. Thank you for watching.